Hello everyone, welcome to my channel A to Z Nursing Notes. I'm Rupinder and the topic of my today's video is delegation. Now, I'd never thought of making a video on the NCLEX topics ever, but when I was preparing for my NCLEX exam, I came across this topic. And when I used to attempt my MCQs on this topic, I usually used to get them wrong. Then I was focusing why I'm getting my answers wrong. And when I dug deeper into the topic, then I came to know about a few things which I would like to share with everyone so that even you can, um, gain some knowledge or gain something from my experience, right? Maybe there are many more people out there who are more experienced and having a much more deeper knowledge, but this is something which I found that it would be helpful for you guys so that you can crack your NCLEX because it is 100% sure that there will be questions from this topic. At least 4 or 5 questions will be there and on from this topic. So this is a very important topic, and I would like to share just my knowledge. That's it. So before coming to the topic, to the exact detail, what is delegation? Delegation is actually the task of assigning the right task to the teammates, right? Like who should be given, to whom we should give the task so that it is best done with the best outcomes, right? Now, as we all know that not in India, but in Canada and other countries, there are different categories of nursing personnel, that is RN, LPN, UAP, and based upon their designation, their scope of practice or their responsibility it varies, right? So we should know about their responsibilities, which person can do what all task, or which person is like having the training, necessary training for that particular task so that it can be done without causing any harm to the patient, right? So first of all, we should know what is the need of delegation. So basically, it is like even the RN, the RPNs, the UAP, they all work for the client for the like to meet the needs of the patients, right? But why there is the need of delegation? Why it is that we have to assign different tasks so that there is division of the work and the patients or the clients they get the best and the holistic care, right? So there must be there must be different patients on the floor, like the critical, there would be someone who is very critical or someone who's very stable or someone who's not very much critical but not very stable also, right? So but due to the shortage of the persons like in different categories, we want that all the patients should get the required care without suffering any loss, right? So we have to make the best use of the manpower available. So the RNs, they can do all the tasks which an RPN can do or a UAP can do, right? But the RPNs are not licensed to do certain tasks which the RN can do. And similarly, UAPs, they are not entitled to do tasks that are done by the RPN or the RN due to their scope of practice, right? As we all know, if you are given the jurisprudence exam, you know that there is different scope of practice for different categories, right? So we should know about what exactly a person can do and cannot do so that there is no legal action or on that person for doing that task or for doing if there is any wrong in that task, right? Now if you look at this diagram, you will come to know that the scope of practice, like the whole of the client care, it falls under the scope of practice of the RN, right? Like an RN can do the work of an RPN also, what all a UAP can even do, right? But an RPN cannot do some of the tasks which an RN can do, right? And similarly, there is UAP who can only do limited amount of tasks, but and cannot do the tasks which are under the scope of practice of the RPN. So if a RPN, if there are three people, RN, RPN, or UAP, and if the RPN or the RN are busy will be taking the vitals, like suppose for whole of the floor, so their valuable amount of time will be lost in the valuable amount of time they will be giving for the critical patients, that will be lost in just doing the vital signs, right? So a UAP we can give the assign the task of taking the vitals to the UAP so that the RPN and the RN are left with the much more of time so that they can devote to the other critical and stable semi-critical clients, right? So coming to the scope of practice of the RN. So RNs, they usually take care of the unstable or the critical clients, and the status of these patients keeps on changing. So there is the constant need of evaluation of the interventions which are done, and constant reassessment has to be done so that so as to assess that whether the decided or the expected outcomes have been met or not, right? So they may have unexpected results from the interventions. So because of that, we have to assess them constantly or repeatedly over a period of time to make sure that the expected outcomes have been achieved, right? So getting hold of the scope of RN is very easy, as you know the nursing process. So it is ADPI, that is assessment, diagnosis, planning, intervention, and evaluation, right? So all these tasks which fall under this category, especially assessment, planning, and evaluation, right? So this is to be done by the RN only. It cannot be delegated or given assigned to the UAP or the RPN, right? So the RN can do the clinical assessment, right, of the patient, education, clinical judgment, which is kind of evaluation, and then IV therapy and blood transfusion. These are few of the things, like a umbrella term for the things which an RN can be done can do. Now this is the theoretical part, that okay, this is what the RN can do. But what day-to-day tasks or things come under this umbrella terms, right? So we will be discussing that in details. So some of the examples of scope of practice is, like if we say that the RN cannot delegate clinical assessment to the RPN or UAP, it means by clinical assessment, we mean that the assessment of a new client. So a patient who is newly admitted to the floor, or someone who is new to the floor, like a patient who was transferred from the other unit, that one, because it needs the RN needs to have the complete assessment of the patient so that the goals can be set and the treatment can be initiated accordingly, right? Then the patients coming from the OT or diagnostic test, again there is an invasive procedure, so the patient may have changes in their condition and that needs to be assessed. That's why it comes under the clinical assessment. Then completing the health history form, right? Coming to the education, so any of the first orientation of the client to the unit, that is to be done by the RN. Any first time health teaching regarding any topic, that is to be done by the RN, and the initial discharge teaching, that is also to be done by the RN, right? So education is a like ongoing process throughout the client care. We all know that, but what the term focuses here is the first time. So the first time, if we are teaching any like home care procedure to the client, so that is to be done by the RN. If the patient is getting discharged, any discharge treating related to his condition, that okay, you do not have to pick up this much weight, or you cannot bend this or do this these activities, so this has to be done by the RN only, right? Then is clinical judgment. So clinical judgment is the evaluation of the outcomes of the intervention. So if you have diagnosed that, okay, this is the diagnosis of the patient, we need to work on that, plan nursing interventions accordingly. Now, once we have intervened, right, or given some nursing intervention to the client, so we have to evaluate whether the outcome has been achieved or not. This task is also done by the RN only. Then is initiation of the blood transfusion, and special focus is on the first time vital signs after initiation of the blood transfusion. So this is a very important thing to note, that we all know that BT cannot be done by the RPN or the UAP, right? But even the first vital signs after the initiation of the BT, they are to be done by the RN. Then evaluation of the client's readiness to ambulate for the first time. If you notice, everything is for the first time. If something we are doing to the patient for the first time, then that has to be done by the RN, because she has the necessary knowledge, skill, and judgment to ensure that the client safety is uh, ensured, right? Then is calling other departments for the client information. This task also cannot be done by any other person, right? If we are like we want to like get some client reports, then it is the RN who will be calling, right? Then is the conveying or consoling the family members. This also falls under the scope of practice of RN, we can say, because it requires the communication skills, and the RNs have the necessary expertise for that also, right? These like judging what all activities fall under the scope of RN is very easy, but what is complicated, or what when you are attempting the questions, what complicates or what confuses you is which task to delegate to the RPN or to the UAP, right? So, because we all know any client who is critical, or any patient who is new, or any patient who has come from the procedure or the OT, that will be the responsibility of the RN. But what about the scope of our practice of RPN, right? So the RPNs, they take care of the stable clients who have expected outcomes. So this is not any hard and fast rule, but it would help you in getting or selecting the right answer. So try to look for the keywords like monitoring, or like reinforcing, right? So what does monitoring mean? Monitoring means that we have already done some action, or some procedure has been done or started or initiated, right, by the RN. And the RPN is either refreshing that, or she's keeping a close eye on that whether there is any variation occurring from the baseline data, right? The first or the baseline data. If any changes are occurring, then that is the duty of the RPN. That falls under the category scope of our practice of RPN. Now let's see at the day-to-day examples for this category. So if we come across the terms like reinforcing client education or discharge teaching, right? So that is the scope of practice of RPN. Most medication administration they RPNs can do. Ostomy care fall under the RPN responsibilities. Specific assessments, right? Now, assessment, we have I've already told you that it is the responsibility or scope of the RN, but it says specific assessments. So if it is the lung assessments, right? If you like have to auscultate for the lung sounds, or for the bowel sounds, or especially the neurovascular assessment, right? If a patient has a cast and there is tingling in his extremity, right? Then that has to be, or there is discoloration of the two toes, right, or the fingers. So that specific assessments falls under this practice scope of practice of RPN. Next is NG-tube patency and the enteral feedings that can be done by the RPN, programming the feeding pump to administer prescribed bolus feeds, and monitoring the flow rate and drainage of the bladder irrigation. Okay, so this is an you can say a reference question, so that whatever I am telling you, you can have a better understanding of that, right? And I've taken it from a random site that is available on the internet, that is Nurses Labs, and my sole intention is to just make clarify what I'm trying to explain to you, right? So it says an experienced LPN under the supervision of a team leader RN is providing nursing care for the patient with respiratory problem. So which actions are appropriate to the scope of practice of an experienced LPN? Select all that apply, right? So it says the options are auscultate breath sounds, administer medications via metered dose inhaler, complete in-depth admission assessment, initiate the nursing care plan, and evaluate the patient's technique for using MDIs, right? Now, auscultating breath sounds, it is we have as I've already discussed, it is this comes under the specific assessment, so it will be the option. And another is administering the medication via the metered dose inhaler. RPNs can do all the medication administration except, as far as I know, the IV. In some provinces, it may be that the RPNs can do the IV also, right? And then why is not option C the right option? Because it says complete in-depth admission assessment. So it is the first assessment which has to be done when a client is admitted to the unit, right? So this is the scope of the RN. Initiate the nursing care plan. Now the word is initiate, means to start, right? And that is the scope of the RN, right? And then there is evaluate the patient's technique for using MDI. Now once evaluation is also comes under the scope of practice of RN. So these are not the correct options. Then what all things can the RPN do? Uh, she can titrate, or he or she can titrate the oxygen based on the unit protocols, like if there is some specific guidelines or some written protocol based on which the oxygen is to be titrated, They can change the oxygen rates according to that, administer the meter dose inhaler, take the nasotracheal samples, then measuring the peak expiratory flow rates with the peak flow meter, collecting data related to oxygen and ventilation. Now this is collecting data. So it is like monitoring the or closely keeping an eye on the patient's status, right? Then monitoring the pain level on assessment scale after initial assessment has been done by the RN. Again, she can do the RPNs can do the pain assessment, but after the initial, that is the first time it has been already the assessment has been done by the RN. So she can do the reassessments. Okay, another example question. The patient with COPD has a nursing diagnosis of ineffective breathing pattern. Which is an appropriate action to delegate to the experienced LPN under your supervision? So option A is observe how well the patient performs per slip breathing. Plan a nursing care regimen that gradually increases activity tolerance. Assist the patient with basic activities of daily living. Consult with the physical therapy department about reconditioning exercises. Okay. So first is observe. That is just to monitor, right? So this falls under the scope of LPN. Second is planning a nursing care regimen. Now planning falls under the scope of RN. So this is the incorrect option. C is assist the patient with the activities of the daily living. So this is the if when we will later on discuss the scope of practice of UAP. So this falls under the scope of practice of UAP. Now if the LPN will be doing the helping the patients with the ADLs, then the like other activities will will like the other patient's need will be neglected. So we will share the responsibility, and the activities of daily living will be monitored or done by the UAP, right? Consult with the physical therapy department about reconditioning. This is the task of the RN, because any communication related to client with the other departments, it has to be done by the RN. Next is the RPNs can also monitor the client for safety hazards, monitor for behavioral changes in the clients. Again, monitoring means that we are reassessing or like looking for any change from the baseline data, right? So that monitoring task can be done by the RPNs. Wound care and sterile dressing change for a client with static ulcer. Measurement of client's leg and thigh for compression stocking. This can be done by the RPN. Irrigate and establish colostomy. Now, established colostomy means a colostomy whose stoma has been healed. There has been fairly large time, and the stoma is healed and it's old, so there are no issues with that. So the RPN at the it is stable, So the RPN can irrigate the established colostomy. Monitor the drainage characteristics like the color, amount, and odor of the drainage. That can be done. Now again, the word is monitoring, right? So make sure that you read the options carefully and select the best option. So broadly, we can say that the RPNs, they do the routine procedures. Routine procedures means something that is stable, right? Most of the medication administration, tube patency and feeding, reinforcing the education which has initially been done by the RN, that is the discharge education or the any other client education. Monitoring the RN findings means that the initial assessment has been done by the RN, the baseline data has been gathered, and then the reassessments are done, and they are for the comparison, right? Or to look for any deviations. Then doing specific assessments like checking the lung sounds, bowel sounds, and neurovascular assessments. Then scope of practice of UAP. Um, if to put it in like simple words, the RN and RPN, they are required to be on in the unit to take care of the stable and the critical clients, right? So any of the task which requires that something which has to be done out of the unit, like you have to bring some stuff, some equipment from outside the unit, or you have to deliver some samples to some lab. So all of the out of the unit tasks or simple activities or very stable clients or chronic clients, they can be taken care of by the UAPs, right? So what is a UAP? A UAP is an unlicensed assistive personnel, right? So this person doesn't have any license; it is unlicensed, and they help the RN and the RPN in their activities, right? So they can only take care of the stable clients. Some like a client who is almost about like very stable conditions, like you can say someone with chronic asthma, right? They can take care of stable clients and usually help the clients with their activities of daily living. So let's see at some of the examples of what all a UAP can do on the floor with the help to assist the RPN or the RN, right? So they can help the clients with the activities of daily living, hygiene, then taking daily weight of the patient, position change, range of motion. Now, if you see, these are all of the activities which are safe and stable for non-risky for the clients, right? Then routine stable vital signs measure. Now this is something you should take note of. They can measure the vital signs before, at the end of the blood transfusion, or any time after the first 15 minutes of the start of the blood transfusion, because the initial 15 minutes RN only can take the vital signs, right? So this is something you have to take note of. Then is documenting the intake output chart that can be done by the UAP, helping in the ambulation, ambulating the oxygen dependent client to the washroom. So let's see an example question. You are assigned to provide nursing care to a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? So first option is assessing the patient's respiratory status every 4 hours. No. Taking the vital signs and pulse oximetry reading every 4 hours. Right. So this is something which is usual, and this is just you are taking or writing down the vitals. So that is the task of that can be done by a UAP, right? Then checking the ventilator settings to make sure they are as prescribed. Patient on ventilator is a critical client, so this will not come under the scope of the UAP. Observing when the patient's tube needs suctioning every 2 hours. This is like observing is like monitoring. So this falls under this scope of practice of UAP, RPN, sorry. Now again, another thing to take note of is that the UAPs can assist with the clients with the incentive spirometry, but the RN is the one who is responsible for teaching the correct technique to the client, right? So please take note of this. This is something which is confusing at times, right? Then is assist in the urinary catheterization by maintaining the position of the client or holding a body part, right? So this is the UAPs, they can help the RPN or the RN in us like maintaining the client's position. Suppose you are doing the urinary catheterization of a female client, then the UAP can hold the client's leg so that you have proper visualization. UAP can collect the urine specimen but not from the Foley's catheter. Then secure the catheter to the client's thigh. This can be done by UAP because it is just securing the catheter. Then picking up the blood bags from the blood bank and returning the unused PRBC bags back to the blood bank. Now, this is something that has to be done out of the unit. So this can be done by the UAP. Deliver the specimens to the lab. Again, going out of the unit, right? Providing perennial care. This can be done by the UAP. Measuring empty and document the drainage output. Now, this can be done by the UAP, but again, to assess the color, the type, the amount, and odor of the drainage, that is the responsibility of the RN. UAPs can help in the change of dressing of chronic wounds with clean technique. They can report the swallowing difficulty of a client during the mealtime to the RN, because the UAPs they usually help the clients with their feeding. So they if they observe that the client is having any difficulty in swallowing their food, so they can report it to the RN. Then reminding the visitor to visit face mask for the isolation precautions, although the initial instructions they have already been given by the RN. So they are just reminding or like making sure that the visitors they wear the face masks for their safety, right? Can reapply the oxygen delivery device but cannot initiate the oxygen administration. So if the patient has removed the mask, so the UAP can reapply the mask but cannot initiate or start the oxygen administration, because oxygen administration is also considered to be a medication administration, which so the UAPs they are not authorized or they don't have the um, license to administer any medications. Then placing the bed alarms for dementia patients, providing dead body care, transporting the dead body to the mortuary, placing the dentures in the dead body before rigor mortis sets in. Okay, some another example question. The ambulance has transported a man with severe chest pain. As the man is being transferred to the emergency stretcher, the nurse assessed the following: unresponsiveness, cessation of breathing, and absence of palpable pulse. Which of the following task is proper to assign to the nursing assistant? Aiding with the oral intubation? No, this is the task of the person with the RN, the RN as well as the respiratory therapist staff, right? Then performing chest compressions. Now, and placing the defibrillator pads, this cannot be done by the UAP, and starting the bag valve ventilation, that cannot be done by the UAP. Performing the chest compressions can be done by the UAP because this is the basic life. This is like the basic life supports, right? And all of the healthcare professionals, they are trained to perform the basic life support, right? So and a UAP has the necessary training and skill for doing the chest compressions, and hence this task can safely be assigned to the UAP. Next, the UAPs can only feed the stable clients, right? Stable clients who are like feeding orally. So if they are not able to feed themselves or they are weak, so the UAPs can help them in feeding. The UPs cannot feed a client who has had stroke 24 hours after admission, right? By 24 hours after admission, we mean like some patient who has had recently had stroke, right? Or who is recovering from any surgical procedure. So the patient may not be having the like proper swallowing reflex. So there need to be an assessment to check whether the swallowing is proper or not. So this cannot be done by the UAP. Another is post precaution signboard and the stocked necessary equipments. This can be done by the UAP, reminding the client to use the incentive spirometer. This can again be done by the UAP. Take the family members to the waiting room after the client goes to the surgery. Keep the environment clutter free to prevent falls like the medical equipment and the wires. Keep the bed in the locked position in the lowest position. Providing non-skid footwear to the client before ambulation, reminding the client to change position slowly. So these all tasks can be done by the UAP. Another question. A patient with sleep apnea has a nursing diagnosis of sleep deprivation related to disrupted sleep cycle. Which action should you delegate to the nursing assistant? Discuss weight loss strategies, teach the patient how to set the BiPAP, remind the patient to sleep on his side instead of his back, administer modafinil, right? So the correct option is reminding the patient to sleep on his back, on his side, because discussing the treatment options or the other interventions does not fall under the scope of the UAP. It has to be done by the either the dietitian or the RN, right? Then teach the patient how to use the BiPAP machine. Teaching cannot be done by the UAP. It has to be done by the RN. Administering the drugs is not the scope of UAP. It has to be done by if it is oral by the RPN or IV by the RN, right? Now, last part is which patient to assign to a new nurse or a float nurse. Now, this question also comes very often, and it is if you are like a nursing supervisor on the floor and you get a float nurse or a new nurse, which patient should you assign to that nurse? Now, when you have to select from the four options of the different clients, right? So you have to see which client is the most stable, right? Or if the you are having a float nurse, so which all procedures or skill requirements that patient needs, which are like similar to the area from which the float nurse has come, right? And if it is a new nurse, then you have to look for a patient which only basic nursing skills are required, like vital signs, insulin injections, tube feeds, or oral medication, right? So, for example, a nurse from the OB-GYN can be given a client with diabetes because there are many, she must be like taking care of, providing care to the clients with gestational diabetes. So, she is well versed of how to take care of a diabetic client, right? Then, if you have a new nurse, so a new nurse can be given a client who has chronic disease and is stable, right? So, chronic disease means the patient has very familiar outcomes, right, or expected outcomes. So some example questions. Jenna is a nurse from the medical surgical unit of a tertiary hospital, right? She was asked to float on the orthopedic department in which she has no prior experience working on. Which client should you assign to Jenna, right? So Jenna is from the medical surgical unit and she has to work on the orthopedic floor. So we have to make sure that the clients which have specifically the orthopedic needs, right? We should not assign that client to Jenna. So a client with a cast for a fractured femur and who has numbness and discoloration of the toe. So this patient is having neurovascular issues. So we can and is unstable. So we will not be assigning to this new float nurse. Then is a client with balanced skeletal traction and needs assistance with morning care. Balanced skeletal traction requires skill and this is a specific procedure related to orthopedic department. Again, we will not be assigning this client to Jenna. A client who has an above the knee amputation yesterday, right? So it is a recent surgery. So the patient is post-op day one and currently has the temperature of 101. So the patient may have developed septicemia or there is some so this client is unstable, so we will not be assigning this client to Jenna. Then a client who had a total hip replacement 2 days ago and needs blood glucose monitoring. So this patient is stable, fairly stable, and needs just blood glucose monitoring. So this patient can be assigned to Jenna so that uh, the patient safety is taken care of. Then is you are acting as a preceptor for a newly graduated RN during her second week of orientation. So by this they mean that this is a new nurse. You would assign a new RN under your supervision to provide care to which of the patients. Select all that apply. A 38-year-old with moderate persistent asthma waiting discharge. A 63-year-old with a tracheostomy needing tracheostomy care every shift. A 56-year-old with lung cancer who has just undergone left lower lobectomy. So this is a client with the recent surgery. So most probably this client is unstable, so this cannot be assigned to the new nurse. And a 49-year-old just admitted with new diagnosis of esophageal cancer. So this is a new patient, so we have to assess what all are the nursing needs of this client and what all we have to. This requires expertise, so this client will be assigned to an expert nurse. But a 38-year-old patient with persistent asthma who is waiting discharge, so discharge, if the patient is being discharged, so most probably this patient is stable. That's where the patient is being discharged. Then a 63-year-old with tracheostomy and needing tracheostomy care every shift. So this is a routine procedure, that the tracheostomy and moreover the new nurse tracheostomy care she is well versed with, so she can be assigned this patient, right? New Any RN like nursing student or graduate has or is very well versed with the tracheostomy care. So this patient can be assigned to the new nurse, right? So I hope that you all have a better understanding of the topic and have a clear understanding of what exactly the task in the day-to-day life on the nursing floor fall under the scope of which categories. And I hope you will never get this question wrong ever. Thank you very much.